Hi, and as I mentioned just before the break, we're now down at Yarra Centre talking to the newest tenants here, the CardiAction, Moose Jaw CardiAction, Dot Hicks and Don Vulcan, who are the only two employees of the whole CardiAction program. Everything else is volunteer, and if you watch in the background during the day, you'll see all these yellow shirts going around, and those are people who help out. But Dot, welcome to the show and welcome to Yarra.
Thank you. Thank you. It's nice to be here.
Now this program, I've done a little research in the last couple of months. It's 18 years it's been in existence, and you've been here all that time.
All that time, that's right, yeah.
So what prompted it to start?
Well, cardiac rehab has actually been in Moose Jaw for many, many years, and Dr. Amies was a pioneer of cardiac rehab, and he had a program way back in the late 60s, early 70s at the Y. So it's been in different forms throughout the years, and it had just I don't know, just disappeared for some reason. I'm not sure why. So they wanted to get it back going again, and I had I was at university as a mature student, and I had to do a fieldwork practicum, and so I found out that they needed this here. So I came and did my fieldwork practicum and got the program going again, and then luckily after it got going and we got funding for it, they hired me as the exercise therapist. So that's how I've been involved all these years.
And thousands of people have gone through the program.
Yeah, we average about 100 patients a year. Yeah, so we're pretty proud of that. And
it's pretty intense because it's a 16-week course.
It is, that's right. Not everyone stays for the full 16 weeks. Some people stay longer, some people stay a shorter period of time because they may go back to work, or they may have had, they come from out of town and it's quite a commitment, so they only stay for a shorter period of time. But yeah, the other thing about it is that our rural patients, we always see all of Five Hills Health Region, so our rural patients come in and see us as well, and then they can get a home program.
And 3 days a week, you're here before 8 o'clock. And that's a pretty neat thing to get motivator and say, sorry kids, I'm leaving, you have to look after yourselves.
Well, it's really rewarding coming here because, all of our patients are motivated. They want to be in the program and they work so hard, and they have good success.
How did you get drawn into to being here?
Well, I lived previously in Meadow Lake, and I became a heart-to-heart facilitator there. But unfortunately, we didn't have the exercise program. We just had that in-class program. And so when I moved to Moose Jaw, I became aware of the program here and thought, boy, that would be a dream job. But of course, there's only one nurse in the position, so didn't think I had too much of a chance being able to get involved. But it just happened by fate. The nurse that had been here pretty much from the beginning was going to move to BC. And so I applied and luckily got the job. So
yeah, I know, and you're pretty intensive, because what happens here is that people come in, and of course there's always a nurse on the site. There's also the EMS is here while the program's, just to make sure that people are safe when they're involved with the activities. And I know one day I went over and asked you something and you thought I was one of your people. I go, no. She says, was your heart monitor tight? And I go, well, no.
Yeah, it's you're just there to help the patients with everything, and yeah.
So the program itself, people have an event, and then they get themselves stabilized through either surgery or medication or whatever. Then they come to see you. What happens to them when they get here?
Well, first, the doctor sends a referral, and most of our referrals actually come from Regina, from the hospital there.
Okay.
And but we do get some referrals from here too. So they have the event, then they come into the office and they see Dawn and I together, and we do an assessment, medical assessment, and then I do an assessment for their physical activity part, and then I make them an exercise prescription, and then they come here and they work out their program according to what we learned about them. Say if they'd had a knee replacement, they may not want to be on a bicycle. They'll go on to one of our new steps, one of our specialized pieces of equipment. So that's what happens. They get an individualized prescription. They get their heart rate, their target heart rate range, that they're supposed to stay within that range to keep them safe, but to make sure that their heart is doing them some good.
And for many years, you were housed at, since the beginning of the program, at Timothy Eaton, and then you just moved over here, brought some of your equipment over with you, and it's a good thing for everybody. Timothy Eaton was a wonderful place to be, and sometime in the future you may return. Who knows?
Yeah. Well, and this gives us the opportunity to expand the program. The province is going towards more of a focus on chronic disease management, and exercise is a huge big part of that. And so this gives us an opportunity to go forward. And Yara have been absolutely fabulous in allowing us to bring our equipment in here, because they had everything all set up. And,
I know.
And ours don't fit in quite as well, but they're okay with it, because we do need these specialized pieces of equipment like the arm ergometers and the new steps.
The arm ergometers, I didn't know I had a name. I was going like the arm ergometer. It's like rowing.
Yeah, it's an arm cycle, basically, but for those folks who can't walk really well, that gives them the opportunity to work their heart, but not compromise their lower body.
Now, when you're here, you're sitting at your table, or you're out and around, you're down when people are on the track, you're sometimes down there. What things are you looking for, and what prompts you to into action, or just sit and stand back and talk?
Well, basically, I'm just looking at everything from a medical point of view. A lot of it is based on how the patient's feeling. If there's any symptoms, we'll immediately assess them and then see what we have to do from there, whether it be I consult one of their doctors, or if it's something urgent, we send them on to the emergency department.
Load them up in the ambulance, which is here on site, and,
Right.
And away they go.
Right. The goal really, though, is to prevent any problems. And so, we're constantly consulting with the doctors a lot of the time in regards to medication changes, because as they get more fit, sometimes the dose has to be decreased, sometimes it has to be changed. So it's just constantly assessing them and changing their care as they change in the program.
And of course, one of the things that really I think both of you are very proud of is the fact that about 80% of the people who come here don't have to come again.
That's true, yeah. It's just amazing that we see the people around town exercising on their own, and it's okay. I mean, a bypass only lasts so long, sometimes a stent only lasts so long, and if they have to come back, it's okay. But a lot of them do continue on. We haven't done any numbers as far as outcomes afterwards, but they do. We see them, and yeah, it's
And your
pretty
yellow
gratifying.
shirts are all people.
And our yellow shirts most of them are graduates of the program or spouses of graduates of the program. And that's a huge component of our program. We have 10 volunteers, and without them, I just don't know how we could operate. The two of us couldn't possibly do it on our own. And that's also unique in Saskatchewan, to have that many volunteers.
But not unique for Moose Jaw, because Moose Jaw is like a volunteer capital of,
Yeah.
and there's people here. Like when I came in and see some of the people that you have volunteering, they've been friends of mine, either workmates from the workplace, or people I've known from the community, and I know that they're good people, and it's a great use of those resources.
Yeah, and they're just fabulous. They just do what needs to be done. It's just amazing how they just seem to know.
Now, when you get some teachers in there, and they kind of like don't want people to not be busy.
Yeah, absolutely. Yeah, you're right. Teachers, and we've got nurses, and it's just amazing. Yeah.
And so you've never had this thing, and your family is very active too as well. Your husband's a busy guy with coaching and stuff, and your kids are, I think, pretty proud of their successes in life too. You've got some hockey players there.
Yeah, our family has always been very active. My husband and I both have a family history of heart disease, and so I think that's really inspired us in a lot of ways to stay active and raise our kids, with as healthy a lifestyle as possible.
Yeah.
Yeah.
For sure. So Now, you recruited your husband into this program.
I
You talked about
did.
spouses.
That's right.
Well, he's been here about 6 years now, eh?
Yeah, he started in 2008, I think. And he retired, and then, as I natter about things at home, he just thought, oh, well, maybe he could help. And so it's above and beyond sometimes what he does for me, which is really nice. Yeah.
So if people want to be involved with this kind of program or be aware of it, they talk to their doctor, obviously, they can get involved. But, what's your contact information over the hospital? How do they get hold of you there?
We work at the Patient Education Center up on the 3rd floor, and the phone number there is 694-0230. But really, talk to their doctor. Like I said, a lot of our referrals come from Regina, but any doctor can refer to the program. And we take patients who have active heart disease, but we also have patients who are at risk for heart disease. So, people with diabetes that are, say, smokers, overweight, high blood pressure, high cholesterol, we'd like to see them before for prevention, absolutely.
Well, that's a great thing. So I want to thank you for being here. Of course, around 8:30, there's an exercise forum where people, I don't know if you call them candidates or patients. What do you call them?
We call them patients, but there's some people call them clients and some people call them customers, but
And all of those things apply.
Yeah.
So they show up, and then you monitor that. Then you're around during the course of the day. So thanks for taking time to come, out of your schedule to talk to us about it.
Well, thanks
and
for having
continued success.
Thank you very much. It's great being here.
Dot, and 18 years and counting. Well done.
thank you very much. Thanks for having us.
Okay, so that wraps it up here at the Yara Center, where we've talked about the CardiAction program that takes place in Moose Jaw. And if you know someone who would benefit from it, make sure that they are aware of it and contact the hospital, but also talk to their doctors about that. So thanks to my guests for being here, and thanks to you for watching. We'll see you again soon on Moose Jaw This Week.